Hello, welcome to my presentation on a controversial method of treatment. My name is Beausoleil. In this video, I'll be discussing electroconvulsive therapy, or ECT. What is ECT? Electroconvulsive therapy is a type of psychiatric treatment which involves the inducement of seizures in patients by sending an electrical current through their brain. There are two primary types of ECT: bilateral ECT, which passes current through both sides of the head, and unilateral ECT, which passes current through one side exclusively. Some background on the treatment. The clinical use of ECT was first used in Rome by Ugo Saletti in 1938. It was used as treatment for schizophrenia. It was later brought to the West in the 1940s as treatment for a wide range of psychiatric illnesses, but it was mainly still marketed as a treatment for schizophrenia and bipolar disorder. The effectiveness. Though it has been proven effective in certain cases, where repetitive use of the treatment method is used over time, some believe it to be a placebo. Researchers into the method of treatment for depression have hypothesized that the therapeutic actions could entirely be placebo responses. In several reports analyzing the long-term effects of the treatment, many patients have relapsed after going more than 6 months without treatment. 49.3% of patients relapsed, or 44% have relapsed in two different reports done in 2020. Controversy and ethical issues. This treatment method is often viewed as barbaric due to the fact that it intentionally produces seizures in its patients. It was already controversial to some since the time of its conception, but ECT developed a particularly aggressive reputation after it was represented in the film One Flew Over the Cuckoo's Nest in the year 1975. After this, it soon saw a very sharp decline in practice. Many of those treated with this method are reported to have side effects varying in severity. 3/4 of patients report fatigue, half report headaches, a fifth report muscle aches lasting several hours afterwards. 6% of geriatric patients are seen to have cardiac complications afterwards. And many experience short or long-term memory loss, with most patients experiencing anterograde or retrograde amnesia. It is reported that this amnesia can take weeks, months, or even years in some cases to dissipate. Currently, it is believed that ECT has now been refined and is undergoing a restricted renaissance. It is typically reserved for those with severe or recurrent mental issues, with which other treatment methods have proven ineffective or do not work. It is estimated that roughly 100,000 people are still being administered ECT every year globally. The future of this treatment. Despite it being viewed as a controversial method and barbaric, there is no indication of it being criminalized in the future, because it has been shown to function and there are many restrictions being placed on it. Whether or not it is effective as believed, it has advanced greatly in the past years and will continue to be perfected. With all the restrictions which the treatment requires, such as limitations on the voltage and preparation for the patient ahead of time, it is currently the safest it has ever been and can only increase in use as time goes on. In conclusion, while electroconvulsive therapy is highly controversial, it has been proven efficient in several cases, and it is forever being built upon to be better in the future. Since its conception in the 1930s, it has evolved greatly. Though the logic it follows has stayed the same after all these years, the equipment and process have been modified to fit the time, and it will continue to be modified as time goes on and more restrictions are placed and more is understood about it. Thank you for listening. Here are my references. All of my references are reliable references taken from the Georgian College Library website, and they are all peer-reviewed articles. Thank you.